Hi everyone. Today we are going to learn about dementia, which comes under organic mental disorder. It is a chronic organic mental disorder, and delirium is a acute organic mental disorder. So today we are going to learn about the definition, causes, clinical features, diagnosis, management, specifically medical management and psychosocial therapies and nursing management. Definition: dementia is an acquired global impairment of intellectual memory and personality without impairment of consciousness. So, it is a group of condition characterized by the impairment of intellectual memory and personality change. That might be a permanent loss of memory or temporary memory. So, without impairment of consciousness. So, it will not affect consciousness. Dementia is an acquired global impairment of intellectual memory and personality without impairment of consciousness. Next, we'll see causes. So, causes. Causes are degenerative, that is cortical, and subcortical degenerative, infection and inflammation, toxic, metabolic, tumors, and trauma. So, degenerative, cortical, that means it will affect cerebral cortex, that is outer layer of cerebrum. So, outer layer of cerebrum, cerebral cortex condition, degenerative conditions like Alzheimer's disease, Pick's disease. If the person is suffering with Alzheimer's disease or Pick's disease, so there might be a 80% of chances to suffer with this dementia. And subcortical degenerative disorders like Parkinson's disease, progressive supranuclear palsy, drunk syndrome. So the person, if they are suffering with subcortical degenerative diseases, they are also have chances of having this dementia. Mainly infection and inflammation. Infections like neurosyphilis, AIDS, multiple sclerosis, post encephalitis. So these infections and inflammation, who are having these kind of infections, they have 80% chances of suffering with this dementia. And toxics, if the person is taking any kinds of toxin or intake of alcohol and carbon monoxide, or a person who has taken heavy metal poisoning, a person, suppose he has taken heavy metal poisoning, after taking intake of this, person may suffer with this dementia. And metabolic disorders like hypothyroidism, hypocalcemia, hypoglycemia, hepatic encephalopathy, chronic uremia and dialysis, and vitamin B12 deficiency, pellagra. So these, if they have these kind of metabolic disorders, so they have chances of having this dementia. So I'm not saying that who has hypothyroidism, they may get definitely dementia. It depends upon the severity. Next, tumors. So tumors like meningioma and parapituitary tumors and normal pressure hydrocephalus. So if the person is suffering with this subdural hematoma, so this kind of tumor, so chances will be more. Next, trauma. If person had a severe accident, so he had gone to he had suffered with head injury, severe head injury. So 90% of chances are there the person may go, if he had severe bleeding from the brain, internal bleeding, so that may cause definitely dementia. So these are the causes of dementia: degenerative, subcortical, infection and inflammation, toxic, metabolic, tumors and traumas. Next we'll see the clinical features. So impairment of following, that means person cannot able to do this, are deficient, you can call it as deficient in thinking, deficient in judgment, he cannot think properly, or impairment of thinking, you can say impairment of judgment, where he cannot, the person who is suffering with dementia cannot make the judgment, and memory loss. There might be a temporary or long term memory loss. in dementia we can see. And disoriented, impairment of orientation, that means he will be disoriented. And this impairment of compression and learning activity. So these dementia people, they take long time to learn. They will be called as slow learners. They cannot do concentration. So less concentration will be done due to his physical condition, physical psychological condition. And calculation, impairment of calculation. Dementia people or patient who is suffering with this condition cannot make simple calculation also. So the impairment of calculation. Next, language. He sometimes he cannot able to speak whatever language he know. He can't able to speak properly. That is impairment of language. So these are the clinical features: impairment of thinking and judgment, impairment of memory, impairment of orientation, impairment of comprehension and learning activity, impairment of calculation, impairment of language. So these are the clinical features we can see in dementia people. Next we'll see diagnosis. How we will come to know that person is suffering with dementia. So definitely we can see a organic change. Personality will be changed. What he was previously, he can't be during dementia. And impairment of short term and long term memory. So we can say short term, simply they forget. For short term and long term memory also can be seen in severe cases. And impairment of thinking by knowing all the clinical features we'll come to have an idea that the person is suffering with this dementia. We have seen these, if the person is having this role, so we'll easily can identify that the person is suffering with dementia. So with that clinical features and higher cortical function, then when there is a higher cortical function, so that means through lab test will confirm this. So with that also will diagnose that the person is with dementia. And personality change. Next we'll see management. So here management is, these are the drugs will be given during his treatment. So this is a specific drug is not there to improve dementia, but for to subside all the clinical features. So we'll be giving these drugs, but it will slowing the progression of dementia. So to improve cognition and slowing the progression of dementia, we can give these drugs: hydrogen, papaverine, piracetam and lecithin. These are the drugs will be given during dementia. Next, psychosocial management is very much important. We'll see in the next session what are all the psychotherapies and all the drug therapies which will come under which, like antidepressant, antipsychotic, antineurotic. So this all we'll learn in next session. So during this dementia, behavioral methods to change his behavior, milieu therapy is given, activity like physical exercises, active and passive exercises, and problem oriented approach. So related to problem, what problem he is having, so according to that we'll be giving counseling. And reality orientation. So if they are disoriented, suppose I said that in clinical feature there will be a impairment of orientation. This person is disoriented, but we'll take by giving desensitization. It is a technique where we can show the person in which place he is. So that we'll read in next session what is desensitization. So by doing that techniques we'll be giving reality orientations. So these are the psychosocial method: behavioral method, milieu therapy, activity, problem oriented approach, reality orientation. Next, nursing management. It's very important and for the nurse to appropriate plan of care. So plan appropriate plan of care depending on the client condition. Only the nurse only can identify the client's needs. So the nurse need to plan appropriate plan of care depending on the client condition, and keep the client in familiar surroundings. I said that the person is disoriented, he don't know where he is, whether he is in home, whether he is in hospital. So he is suffering with disorientation, like he don't know where he is, time, person, environment. So keep him in familiar surroundings so that he can remember, and provide safe environment. So do not keep any harmful like sharp object or which is harming the patient. So safe environment is very important. And safe environment, it does not mean only sharp object. Safe environment means if the person is cannot able to walk properly, he doesn't know the way, he might fall down. So safe environment is very much necessary. And maintain calm and quiet environment. So here patient should not be irritated. So we need to maintain calm and quiet environment. And it's very necessary to give reassurance. If the person is suffering with dementia, he will be in psychological depression. So reassurance should be given. And development of trusting relationship. So to open up, some patients cannot open up with strangers. So as a nurse, we should develop trusting relationship with the patient so that he may open, he can have conversation with the nurses. Make him to do self care. So self care activities are very much important, like little care, combing himself, taking bath. So self care should be given. So it is a kind of activity also, and it is a kind of diversional thing also. So this is the nursing management. And apart from this, use simple explanation. When you're talking to a patient, we need to give simple explanation. We should not use difficult words or difficult language in front of them. We have to use simple explanation. So this is about the nursing management who are suffering with dementia. So we have seen